Very early in the pandemic, and especially during wave 1, it was very clear that no country can afford to accommodate these many patients in the hospital because there are no resources, be it doctors, bed or nurses. Not just COVID patients but also cardiac patients are greatly getting impacted. Medanta along with the 𝗨𝗧𝗏 introduced these devices which were able to help patients to take their cardiac ECG at home within 30 seconds. The same ECG report is available in the Medanta Heart Center, which is monitored 24/7 by senior cardiologists, which means that patient has that full confidence and trust and faith that his ECG is getting monitored, reported, and clear-cut call to action was there.
ECG is central to any cardiac diagnosis. When a patient enters the hospital, cardiac consult, what does he get first? An electrocardiogram. And that is the value of 𝗨𝗧𝗏𝗏, that this is electrocardiogram done remotely. It may be in a busy marketplace, it can be at the person's home, it can be anywhere where even a doctor is not available. So the thought process was, many indications for doing an electrocardiogram are not located in the hospital. But the patient says, I have got palpitation. Patient says, I fall down sometimes. Patient says, at 2 a.m. I'm getting up with some discomfort in my chest. All these can be diagnosed at ease with the use of 𝗨𝗧𝗏𝗏. Of course, there are many devices. We can do a Holter monitoring, we can do an ELR, many things, but they are all at a point of time. 𝗨𝗧𝗏𝗏 is a simple device. She does not have to wear it on the chest. They just keep it into their pocket, and with just the touch of their thumbs, they can send an ECG to me. They will come at any point of time to a cardiac station which is impaneled into the heart command center, where 24/7 the ECG will be picked up, reported by one of my cardiology doctors, and immediately they will talk to the person that, sir, this is the ECG, come immediately or just take it easy, don't even worry about it.
We at the 𝗨𝗧𝗏𝗏 station get ECGs round the clock. Once we receive the ECGs, we interpret them, and according to what the condition of the ECG is, either it's normal, then we tell the patient that it's normal. If it's not normal, we tell them either to rush to the emergency department of our hospital or any other hospital close by, or we tell them to meet their treating physician the next morning.
I followed 𝗨𝗧𝗏𝗏 for a long period of time and have been very impressed by the kind of innovation that they've shown in the healthcare space. And we were very happy to partner with 𝗨𝗧𝗏𝗏 to help provide our patients with the kind of cardiac care that 𝗨𝗨𝗏𝗏 has enabled. This little device, which is smaller than my hand, is a 6-lead ECG device that we give to our patients who could potentially be suffering from cardiac complications, arrhythmias, etc. And they can, from the comfort of their home, send across ECGs. We in Medanta have a 24/7 cardiac monitoring center where we will review these ECGs, get in touch with the patients, connect them into their clinicians, and allow for a kind of continuity of care, allow for a kind of care that is delivered to the patient at their home using the help of these kind of technologies. And that, I personally believe, is the way in which healthcare will move forward, where you're able to take technology, the clinician and the patient, and integrate all of these in a manner that will allow for better, cheaper and faster delivery of the highest standard of healthcare.